Sometimes the simplest diagnosis for a greyhound unable to walk is a corn in one of their pads. This episode's guest developed the preferred surgical treatment to solve the corn problem for greyhounds and sighthounds. We talk to him next on Greyhound Nation. This is Greyhound Nation, episode 52, recorded December 28, 2025. Dr. Mike Guilliard, a surgical solution for greyhound corns. Greyhound Nation is a podcast for greyhound enthusiasts produced by greyhound enthusiasts. To learn more about our show and its hosts, visit our website at greyhoundnation.dog. That's greyhoundnation.dog. Hello, and welcome to another episode of the Greyhound Nation podcast. I'm producer Mike. And for this episode, I'm going to recommend that you watch this on YouTube rather than just listening to it on your favorite podcast app. Our guest today brought a presentation that is going to really help reinforce the topic about greyhound corns and greyhound corn surgery. Trust me, it's worth a watch. And now, here's your host, John Parker.
Thanks, Michael, and welcome back, greyhound lovers. Our guest for this episode is Dr. Mike Guilliard of England. Dr. Mike has perfected a surgical technique for dealing with the dreaded greyhound corns. So, Dr. Mike, welcome.
Thank you very much. Look forward to telling you all about corns, John.
I saw Dr. Mike do a presentation at Greyhounds in Gettysburg this year. Found it fascinating, and a lot of people have greyhounds that develop corns and cause lameness. So I thought this would be an excellent opportunity to have our viewers and listeners learn a little bit about it. So Dr. Mike, tell us a little bit about your veterinary background, where you went to vet school and the nature of your practice initially and how you got interested in greyhounds.
Yeah, I can do that for you. I qualified a long time ago at 1972 from Cambridge University in England. And I went from there, it's my second job. 6 months after I qualified, I went to a little market town where I still am, called Nantwich in England, and I joined a mixed practice there. The senior partner, Jimmy McWilliam, was very much into his greyhounds, and he had coursing greyhounds and track greyhounds, and so greyhounds were coming through the door all the time, and I got pushed into it to treat them. And I found it fascinating. I realized there wasn't very much in the literature on how you treat them in those days, and I sort of progressed from there. And so I've gone on and I've sort of kept greyhounds myself. I've been a track vet for a while. I've been the vet on the coursing field for the Waterloo Cup. Jimmy McWilliam was a nominator at Altcar for the Waterloo Cup. And so for the last more than 50 years, I've been seeing greyhounds, still am. And we've got one retired racing greyhound at home, and we've got two greyhound Malinois crosses, which are absolutely lovely. So does that tell you everything, John?
Yes, I think that's a pretty good wrap up. Where is your surgery, or as we would call it in here in the States, your clinic? Where do you practice from, and what's the name of it? Let's give you a little plug there.
Well, I am sort of semi-retired now. I've been at the job very long, and I was in a huge practice in Nantwich. We built a big veterinary hospital, state of the art. And I retired from there, and I went freelance, and I have my own business called Mike Guilliard Orthopedics, and I am based in Cheshire, in England, in just outside Nantwich, and I work out of other people's practices and use their facilities.
And are you still seeing greyhounds, track greyhounds from time to time?
Yeah, I have been. It's this last few months that's dropped off a lot. The track system of they tend to have their own vets now, and their own vets do their own surgeries and everything. They're quite well equipped. But up to 12 months ago, I was seeing an awful lot of track greyhounds.
Yeah.
But most of my work now, John, is with retired greyhounds, greyhound pets, and really because of this corn business, I am very busy with that, and corns are the commonest cause of lameness in pet sighthounds, not just greyhounds. And I see almost as many whippets as I do greyhounds, foot lameness, basically.
Yeah. What got you interested in corns in sighthounds in particular?
Yeah. Well, um, I'd always, I, obviously, I've seen corns all through my professional career, and we never knew how to treat them. And I went down the line of cutting them out. And I could cut them out very easily on the pad. You had to anesthetize the dog and do an elliptical excision around the corn. The whole lot came out and you could throw it away. Then you stitch the pad up and it'd have a dressing on for several weeks. And the dogs went sound in the short term. But the problem was that many of these dogs, the corn returned several months later. And so I did a study on my corn cases, which led to a publication in the Journal of Small Animal Practice, a peer-reviewed journal. It's international, and this is in 2010. This was published, and it helped me realize just what was going on with these corns. In this study, I had 30 greyhounds with corns, but there were 40 corns. It tells you that some greyhounds get multiple corns. And I did all the demographics and things, and I realized what everybody else had found out before, that corns tended to appear in certain toes, in certain limbs, and I worked my way through. And then I followed up the success of my surgery of cutting these things out and phoning people up years later sometimes to find out. And I realized that 50% of the dogs that had cut the corns out successfully, they were lame again in a year's time when the corn recurred. And then if you went into the 5-year follow-up, 75% of them were lame again. So there's obviously something going on there. It wasn't just a question of getting rid of the corn, but there was some underlying cause that was causing it. And I sort of started delving deeper. Lots of people have sort of gone through all this, and there are lots of theories as to what caused corns. I mean, the simple one is that it's a viral infection. It's like verrucas in people. That's been discounted now because a lot of researchers have looked at corns and looked for these viruses. Effectively, they're not there. So you can discount that. And then the next thing that people thought about was foreign body penetration. And this survey that I published, we did quite a bit of a histology on these. We never found any foreign bodies in the pads, but what we did find was secondary penetration of where the corn was, because a corn, it's not just what you see on the surface. It actually it's conical and it's got a soft center, and we were getting secondary plant material going inside, but there's no primary foreign body. And then the final thing was the mechanical theory, the pressure theory, which is what happens in humans. You can either get it with tight-fitting shoes, where you get a callus or a corn on your toe, or you can get it with a toe deformity, called a hammer toe in humans, where the toe is bent and that toe is hitting the ground. And so it's generally thought that it is a pressure problem. I think, John, we ought to go back to and say what a corn is, and start
That's
at the very
great minds
beginning.
think alike. That was going to be my next question.
Yeah. All right. So corn, to say technically, it is I'll use scientific language. It is a focal area of hyperkeratization of the pad. Now, focal means it's just in one little place in the pad. Hyperkeratization is a proliferation of keratin in the pad. Now, keratin is the structural protein of the skin, and it's responsible for claws, horns, feathers, scales in fish. All of these are made of keratin, and so it can become quite a hard substance. And it's part of the skin, and it holds the skin together, if you like. But the pads react to pressure by producing more keratin. This is meant to be protective. If you cut yourself and you let it heal, you get quite sort of calloused margins to the cut. That's keratin trying to heal your body, and it's the same with the corns. Now, for some reason, we really only see these in Sighthounds. We do occasionally see them in the other breeds, but 99% of corns appear in the Sighthounds. And the reason for that is the Sighthounds, if you've got one at home, if you stroke it, you'll see that it's got very thin skin. And it also has very little fat on it normally, unless you let your dog go to seed a little bit, but most greyhounds have hardly any fat. And it's got less cushioning under the pads in the feet. And also this causes this hyperkeratization reaction because it bruises the feet. So that basically, as John, is what a corn. And they come in all different shapes and sizes. I mean, the picture on the front of my presentation shows, if you like, a typical corn. You can see this round area of roughened pad, and it can be quite proud. It can stick up, and sometimes all you might see is just a little dot in the middle, little black dot, and that is probably the center of the corn. But that corn will be conical, and it will grow into the pad, and it just causes intense lameness because there's no cushioning under it, nothing to soften it. So that's basically what a corn is.
Do you see them? Are they more prevalent in retired racers, or is it about the same with active racers? I think of active racers as running on a softer surface than your typical retired greyhound will be walked on, and I just wondered if that makes any difference.
No, I don't think so. It's not really a problem with racing greyhounds. Obviously, you do get them, but I think one of the causes is anything that is foreign body penetration. And often these racing greyhounds, they're kept in the countryside, and they may walk around hedges and things like that. They may get thorns in the feet, and these can develop into corns. The thorn in there is long since gone, but it creates a reaction within the pad, and scar tissue is laid down, and that increases the pressure within the pad, which causes the corn to develop. I don't think racing itself has much bearing on it. As you say, they race on soft surfaces, but lots of pet dogs are kept on soft surfaces. It's nothing to do with that. I think there's a genetic component as well, that some dogs are particularly prone to it. But I think we want to just go back and talk about why I decided that the treatment, that the pressure was causing it, from my paper in 2010. The first thing I noticed was that in two of my cases, I treated the corn not by cutting it out, but by removing the last joint and stitching the pad over the bony stump. It's not something I'd recommend, but then we're trying everything. And I didn't cut the corn out of the pad, I left it there. And I noticed that corn actually grew out. what's called exfoliation, and we're left with a normal pad. So I realised that if you can take the pressure off, well, then the pad can revert to normal, and indeed that's what it does. People have thought about this for ages. At some stage, some researcher in the States, he tried putting silicon gel implants under the pads to see if that reduces the pressure there, and indeed they did, and it sounded quite promising, but I don't think he took it through to racing greyhounds. So I theorised that if we could remove the pressure on the pad, the corn would disappear, and that's what led to me finding this solution by cutting one of the tendons in the toe. But that's maybe that's the next stage. Are we missing out, John?
Yeah, so it has to do with the way the foot strikes the ground as the dog walks. Is that
Yeah.
basically it?
Yeah, normally they do, but there are lots of problems that can. Yeah, a normal greyhound with a normal pad is fine. If you can get problems which affect the toes, the mobility of the toes. You can get if you talk. Yeah, I'd like to show a slide if we could. Maybe
Sure, go right ahead. We're trying something new here, viewers and listeners. We're actually Dr. Mike is sharing his screen with his slides from his Greyhounds in Gettysburg presentation. So, Mike, get that one up, and you can tell us about it.
Yeah, I'm just going into that presentation now. Still hear me all right?
Yeah, there we are.
Yeah.
You're scrolling up.
Yeah, I think I'll actually go through it as we've gone through what corns look like. Let's go back a little bit. Let's go back to how common are corns. They are the commonest cause of lameness in pet greyhounds. It's the most common dermatological condition that vets have to deal with, and almost certainly they're underdiagnosed because it requires a certain skill to detect them. Some are very obvious, but I detect them by palpation. You can you look at them and you can see them. You can palpate the pad and see if it's painful. But you can actually, if you squeeze the pad from side to side, you can actually feel the thickening within it. So, as they say, it's the commonest cause of lameness in Sighthound breeds. And the lameness can be very severe. These dogs can be on 3 legs and they'll come hobbling in. And because a lot of these dogs can get them in other feet and other pads on the same foot, that's very common. And I compare it to having a stone in your shoe, having that there. So, clinical signs: lameness, mild to non-weight bearing, worse on hard ground. They come into the surgery and they might stand with their foot held up. They don't want to weight bear on it. And the other big thing is they can be very depressed. They're reluctant to walk far. And after they've had successful surgery, the owners will report that they've got their dog back to its happy self. So we say the diagnosis is, well, observation, and say there's little to see sometimes. And it helps if you wet the area. You might see this black spot. And with modern phones, it's good to photograph the pad and blow it up, and you'll see different changes to the pad. The one thing you want to make sure you haven't got in there is an actual foreign body in there, which you can get with a bit of glass or something like that. If you've got something like that, and you usually got a discharge or an ulcer, and the X-ray will show that. So I think this stage you just go back to the historical treatments of how people have managed corns. We call it a conservative management, where they did it with no surgery and they'd put on all sorts of ointments, balms, things to soften the corn, something to burn the corn. People pick away at them and get them to come out. Doesn't work. May make the dog slightly happier. The other people talk about is something called hulling. And this is basically where the corn is semi-cut out with the curette. It's scraped around and it comes out. Very imprecise term, because nobody's really defined it. I mean, some vets will cut more or less like an excision and cut it out, or others just scrape the top and dig some of it out. Invariably, the corn comes back. Then there's the excision of the corn that I've been talking about. Invariably, most of these will come back. And in the past, I used to amputate toes because it was so painful. But I certainly don't do that now. In this journal article, it was called Corns in Dogs, Signalment, Possible Etiology in Response to Surgical Treatment. We found that approximately 90% occurred in the central toes in both the front foot and the back foot, but 90% really 90% occurred in the forelimbs, and these are the main weight-bearing limbs, the forelimbs of the dog, the front limbs. The central toes, these are the main weight-bearing toes. So in that survey, I found that 37% of dogs had multiple corns, and this means at either initial presentation or they developed after surgery. And this is, in fact, the case now. I looked recently through my records at about 500 dogs, 300 dogs with just over 500 corns. And again, 40% or more, 42%, I think it was, had multiple corns, either at initial presentation or after they had successful surgery. So we had gone through the mechanical theory and the predominance of the main weight-bearing toes, then anatomical deformities, the hammer toe in humans, whereby the knuckle joint, if you look at a toe, you've got, I like to call it in the vernacular really, is a knuckle where it sticks up. Sometimes that contracts and that toe is dragged backwards a little bit and more pressure is put on that toe. That's due to tendon damage further up the leg. And sometimes you see it if you get a fracture in the last bone in the foot. Again, it increases the pressure under the pad. And then maybe if we come on to the main part of this presentation is, what have I done that's worked? And that's called superficial digital flexor tendonectomy, big words, which effectively means cutting one of the tendons going down to the toe, and that releases the pressure on that toe. Now, just moving down here, let's just go at the anatomy now, and you should be able to get this slide up. We're looking at there's two tendons which work the toes, and they come down the back of the leg. There's the superficial digital flexor tendon, and when you see the picture, you'll see that attaches to the bone just below the knuckle, and that causes the knuckle to rise. And if that tendon's damaged or cut, that knuckle will drop, and we have this on a slide. You can see it's slightly less. That drops, and the toe just moves forward a little bit, but the nail stays in contact with the ground. Now it stays in contact with the ground because the other tendon that goes down to the toe is the deep digital flexor tendon, and that comes down all the way down and attaches to the bone where the nail is. And so that will pull the nail down and touch the ground. It will keep some flexion in that knuckle joint because it's attached to the bones on its way down.
Here's a question that
Yeah.
occurs to me. Do the length of nails have a bearing on any of this? In other words, does it help to keep nails closely trimmed and off the surface of the ground, or does
Yeah.
that seem not to matter?
Yeah, I would always say keep them trimmed. I'm not sure how much of a bearing it has on it. The long nail is usually secondary to the problem in the foot, and the dog isn't wearing the nail down naturally. But yes, I don't think it's a primary cause of corns at all. But definitely, they should be kept short, kept trimmed. So the deep tendon attaches to the foot, and so this is what I call my journey. When I sort of finally got the courage to try cutting a tendon to see if it helped corns. And I knew from the racing dogs that they damage tendons in the foot, and they damage the superficial tendon, and they get a swelling just below the wrist at the back, what we call the metacarpus. And one of the treatments for that is to actually cut that tendon out. And these dogs come back and they race again, and it doesn't bother them. So I thought, well, cutting that tendon's probably okay. But I first started cutting both tendons, and it was great trepidation I did this, but a greyhound trainer, he got a pet dog and he got a corn. He said, can you deal with this corn, Mike? I said, yeah. We cut it out. And
So the first patient one was a pet greyhound still
yeah,
kept by the trainer.
yeah. It's a retired greyhound. It lived in the house and it had a corn, and he knew what a corn was. And so I said, we'll cut it out, as I did in those days. So we cut it out, and then the tendon came back, the corn came back. And he said to me, can you amputate the toe, Mike? I said, I prefer to just try this method first and see if this makes any difference. So that's what I did. I cut both tendons, the deep and the superficial. That's a little bit alarming in that it drops the toe completely and the nail rotates upwards. But the dog was sound. The corn went away. And then 4 or 5 weeks later, I was doing a kennel inspection on greyhound kennels, and the trainer brought this dog out, and it was lame on both its front legs. He said, it's got corns. I said, can I try this surgery? He says, yeah, of course you can. So I operated on both front feet, and I cut both tendons under the foot, the superficial and the deep, and that dropped the toes completely. And then, against my advice, he had that dog back on the track 5 weeks later, and it never looked back. The corns grew out, and I knew I was onto something. And then we ran into one or two little minor problems. One fairly major problem: in a low percentage of dogs, the foot bent too much and the nails stuck right up, and the knuckle joint was actually in contact with the ground. The dogs were incredibly lame, so that wasn't very good. So basically, I reckon that if a dog had another corn in the same foot, and we've done the full tenotomy, cutting both tendons there, I then thought, well, maybe we should just cut the superficial in the other toe and not drop the toe completely. And so that's what I did. And so we had quite a big series of dogs running around with one toe cut, the full tenotomy with both tendons cut, and the other one cut with just the superficial tendon cut, which makes the toe drop a little bit, and that worked very well. And so the surgical technique is relatively simple. You identify the tendons by bending the toes upwards. Your assistant does that, and you can feel the flexor tendons at just below the wrist, above
So
the.
what we have in the picture here that's on the screen, that's the superficial tendon.
Yeah, that's the superficial. Yeah,
And so it's a tiny little incision that you need to make. And
yeah,
you just
that's a secret. Look, if you look at this slide here, you can see the black arrows point to the flexor tendons. So we've got the toes bent right back, and that's making them stand proud. They're just covered over by skin. And then I just make a very small cut, maybe only a centimeter long, and you drop down actually onto the superficial tendon. And then you can get under that with forceps and identify it and free it, and then you can cut it. And that is your tenotomy, if you like. It's called superficial
how,
digital flexor tenotomy.
how long does the entire procedure take?
Oh, that's giving secrets away, John. Yeah, it doesn't. There's a lot of preparation and things. It's,
Right.
I mean, the surgery may only take sort of 10, 15 minutes, something
Yeah.
like that.
Yeah.
But, there's a lot of preparation and things. Anyway, just moving on. Well, if you just do the aftercare, pressure dressing on just for 24 hours, take it off, and lead exercise for 10 days, and the dog can run.
And when you cut it, when you cut the tendon, you just leave the ends in there. Nothing's removed as such, and
Well,
then you just sew the skin back up.
yeah, that's the next part of the story, if you like, of the
Oh,
journey.
okay, very
Yeah.
good.
Well, okay, we'll just go into that now. We found that quite a lot of these dogs, the lameness would recur and the corn would come back. And we realized that this superficial tendon is actually rejoining, even though it sort of springs apart. And you could feel it. Nature's marvelous how it repairs things. And you could feel this thickened tendon just above the foot where it had rejoined. When it rejoins, it then contracts and it puts extra pressure on the pad, and the corn can come back. So then we decided to remove a section of the tendon. This is technically called a tendinectomy, where I would go in and I would free this tendon up and remove, if I could, about a centimeter of it. And I thought that'll work. But like all things in nature, it wasn't 100%. And some of these rejoined as well. But I'll come on to
So
them.
the
Yeah,
two
sorry.
tendon ends just basically find each other
Yeah,
in the
well,
anatomy and form
yeah,
scar tissue and rejoin.
yeah.
That
What you
truly
get,
is amazing.
yeah, you don't sort of find each other as such. What happens? Well, I suppose they do. What happens is if you do any trauma or anything, you get scar tissue laid down, fibrous tissue, which is help with repair tissue, and that will be all the way where the cut was and around the tendon ends and things, and then this organizes and it reverts back to almost, it's fibrous tissue. It joins the end of fibrous tissue, and this remodels and effectively becomes a tendon again. It might well be, well, it will be thickened, but yeah, that's how the body heals it in a lot of cases. So let's go back. Let's go back to the short-term outcome. They published this in 2021 in the Australian Veterinary Practitioner, which was great because it got it out to vets, and I'd written up in some of the news journals. Well, they come out once a month, like Veterinary Times, things like that, and an American journal, so people were aware of it. But it was good to sort of get some results out. So in this paper, I had 100 dogs, 121 corn, 161 corns, and I had the combined tenotomy, which was the superficial plus the deep digital flexor, full tenotomy in 113 corns, and the superficial digital flexor tenotomy. This is before we were removing bits of tendon in 48 corns. Corns weren't treated. We just left the corns to grow out. At 8 weeks, 95% of corns weren't present, and there was a marked improvement in lameness scores at 7 days, and the lameness scores at 8 weeks. There's a lot of them that we were down to 84% with no lameness, which is very good. And the medium term and long term outlooks were pretty similar. Superficial digital flexor tenotomy 6 to 9 months. 20 out of 24 cases, slight or no lameness. The full tenotomy at 1 year, 96% slight or no lameness, which is great. And we just covered the complications, and the big one is this hyper extension of the knuckle joint, and then tendon rejoining. So you're getting what are the complications of a superficial digital flexor tenotomy, tendinectomy? I think if you get no improvement, that can happen, and you've got to make sure you check your diagnosis, make sure it's correct, make sure there isn't a corn in another pad on the same foot, which it can be, and make sure the dog hasn't got something horrible like a bone tumor. Then we got this corn recurrence, tendon rejoining, and that's when we changed to a tendinectomy. And I've actually got a picture here of a tendon rejoined, and I, for the revision to seeing this corn recur, I decided originally to go in and remove the rejoined tendon, and you can see it on the slide here, what it looks like, but it's a definite tendon, a bit thicker. So we had sort of what's called revision surgery, and lots of places you can do it. I did it originally mainly in the same place that I did the original surgery for the superficial, and you could remove both tendons there. And then I went to do what my preferred way of doing it now is to go under the foot and cut both tendons and drop the toe completely. And I think you get less complications with that, because even with your revisions, you can get tendon rejoining. So lots of questions and things, but let's just go this. Well, some people say, will tendon surgery increase the risk of more corns on the same foot? Logically, you say yes, because if you take the pressure off one pad, one toe, that means the other 3 toes will be weight bearing with more pressure. And so you'd expect maybe to see increased incidence of corns in those. So we looked at my 305 dogs with 508 corns, and 128 of these had multiple corns, which is 42%. So it is very common. 30% were a presentation, and 17% went on to develop further corns. So you get these corn dogs, and they can be quite difficult to treat. But we got no increased incidence of corns forming in the same foot as the surgery, and you would have expected there was a random expectation of 25%, and it was actually below that in the same foot. So other questions I get asked: can you do more than one corn in one surgical session? And the answer is yes. What I do is I cut all the every pad that's got a corn on, I will cut the tendons, the superficial tendons on that toe, on that digit. It is very benign surgery. It's not painful at all. It's very brave of me to say that because I've not had it done, but I see these dogs the next day. They're usually quite often a little bit better the next day rather than worse or anything, and the incision doesn't seem to bother them at all. It heals very rapidly. So we can do, and I do, multiple corns. And what's the largest number of corns I've seen? Well, I've seen it in 7 different pads, and with 3 surgical sessions. Now, it's not ideal just cutting tendons, and it certainly shouldn't be done prophylactically to stop corns from forming, because you are altering the anatomy of the foot, and the weight bearing alters, and these dogs can get a little bit tender under the feet, but it really does help these dogs and get them back to normal. You get your difficult cases, of course you do, and some you can't really find a solution to. With, like a case here, if you've got both central toes have been amputated, well, it's going to put more pressure on the outer toes, and almost certainly will get corns there. But the take-home points is, well, the first one is that from that original research, the superficial digital flexor tenotomy stroke tendonectomy, either just cutting the tendon or taking a section out, or if it's combined, and the combined full tenotomy where both superficial and digital flexor tendons are cut. So either the superficial, the simple one that we always start off, or the revision one where we cut both, but they both gave comparable results. So the primary treatment is just taking out a bit of the superficial tendon, and revision is, for me, is I do a full tenotomy under the foot, between the main pad and the digital pad. And there, the important thing from the vet's point of view is to find all the bundles, because there are multiple bundles of tendon, of both superficial and deep at that point, and it's very easy to miss one. So you've got to actually cut down onto the bone of the first phalanx. So, John,
Do you find that when you go in and your initial intention is to cut the digital, the superficial tendon,
yeah,
and then do you sometimes get in there and visualize it and decide kind of on the spot, well, I'm gonna cut both tendons?
no, you go in, if you get a dog with a corn, you just cut the superficial. That's what I do first of all, and then if I have a problem, a revision, I'll cut both tendons, but always go in and just do the superficial. You do the least harm that you can. And that's my theory here, because you always got the option of going in again and doing something a little bit more.
Yeah. With the flattened toe that you get from
Yeah.
post surgically, does it change the way the Greyhound runs at all? In other words, are they more at risk of, say, a toe dislocation? All of us Greyhound owners, that's the bane of our existence, of course, is toe dislocation. Does that increase because of the change of the anatomy and the flattening of the toe? Does that increase chances of say, a dislocated toe?
That's a very good question, and I don't think it does. I think, they cope with them very well, and I think the more that you do to the foot, the increased risk is. Certainly, if you amputate a digit, there's quite a risk to the other digits that you can get dislocations in the toe and things. But that's something else.
Yeah.
But no, I think basically what we do is we take these dogs out of pain, and they're miserable, and you get them back to normal, happy dogs, which you can go at their odors, and they can run around, and they can run around on hard ground, and everybody's happy, especially the dog.
Now, for our American listeners, is this technique being spread in America to veterinarians over here?
Yes, very much so. It's worldwide now, and I get quite a lot of emails from the States, Canada, and places asking for advice on this. But it's all written up. We actually got it. I actually got it written up in veterinary dermatology, which is the top dermatological journal in the veterinary profession, and so it's widespread, and it's being done in all the universities, as far as I'm aware. It is the treatment of choice. It's fantastic.
And have you done an instructional video
Uh,
for the vets in other countries that
well,
can't
well,
come watch you do your work?
yeah, well, I did originally. I'm not sure what's happened to that, but I think there are plenty out there. Lots of people, lots of clinics put out their own videos and promote it themselves now.
Yeah, yeah.
And I'm, as a result, I'm done myself out of a lot of business, if you like.
I would
If
think so. Yes.
I was
How many do you do on average, say per month? Now I know you're somewhat retired, but how many would
mm,
you say on average you
well, I
do
was
of these?
I was doing about 4 or 5 a month. I'm down to about 1 a month now
Uh,
because, yeah, bit too successful. But
yeah,
there you go. I've made a lot of dogs happy. That's the main thing.
that's
Yeah.
right. What's the aftercare? For example, the dog does the dog go home that day of the
Yeah.
surgery?
Yes, I send them home straight away, and they'll walk out, uh, and although they've got a bandage on, some of these dogs are less lame when they walk out. The aftercare, as I say, just keep them on the lead for about 10 to 14 days. The sutures, I put in absorbable sutures, which drop out after about 4 weeks, or you can have them removed. And that's it. After a couple of weeks, I'm quite happy for the dog to run around, as long as the skin incision is healed. That's fine. The dog's free to go, and you normally expect that by the time you get to about 4 weeks, you should see a vast improvement. And if the dog's still lame at 6 weeks, I think you need to see it again and see what's going on. And as I say, it can take up to about 8 weeks for the corn to grow out. And then hopefully you're left with an absolutely normal pad, no sign of the corn at all.
So the corn is still physically there, and because of the way the surgery has caused the the anatomy to strike the ground when it walks, it just
Mm.
kind of falls
Well,
out,
no, it doesn't. No, it doesn't. Well, it doesn't really hull out or anything. It just grows out. It's
grows
the
out.
Yeah, the germinal layer where the sort of skin is laid down, is normal. Lays down normal skin and pushes the if you like, the thickened skin out. It's like if you have sunburn, your skin flakes because it's been
Yeah.
damaged, comes off, and you're left with normal skin. It's just the same, which is, great finding. Yeah,
So do greyhound owners find that they look down one day and there's a corn that's fallen out? Is it
yeah.
that uh,
It
obvious? Uh,
it happens. Yeah, it happens. They're absolutely delighted. They'll send me a picture of it.
yeah, I'll bet. I'll bet. Um,
Yeah.
do you have you had many greyhounds that have had not necessarily revisions, but they've come back to you with, say, a corn on a different foot?
Yeah, I was saying that um, most of them have. Yeah, I mean, most of the multiple corns are on other feet, and it can be front feet or back feet or all 4 feet. That's the common thing. The commonest recurrence of a corn is on a different foot.
Yeah.
But sometimes you get it on the same foot as the original one, and it's the next toe to it. It can be any combination, actually.
Do you uh, do you recommend any kind of other treatment to keep the corns from coming back? before, or you just kind of take a wait and see attitude, and if it recurs on another foot, then you just do the repeat surgery there.
Yeah, that's right. That's what I do. I don't think you can prevent them. I like the dog to have a normal life, and hopefully, I suppose exercising more on grass maybe helps. I don't know, but yeah, I think if they go lame again, we see them and treat the new corn. I don't think there's any way of preventing it because it's genetic, if you like. I think certain dogs are predisposed towards them. Um, Quite interesting, and if you look at Whippets' feet, they're very tight. The feet are, the knuckle joints are quite tightly flexed, and I think that might, if they're over flexed a little bit, as I said, which you can see on one of the slides, I think that might predispose to corns.
Yeah. And do you find do greyhounds predominate? You find more horns in greyhounds than any other sighthound breed, or is it pretty evenly spread?
Well, because they're retired dogs, I see. I think it's pretty even, and it is more. It is more greyhounds, but I think, mate, there are probably more greyhound pets than there are whippets. It depends what part of the world you're in, what country you're
Yeah.
in. There are quite a lot of whippets around here, which are pets. Some of them are working whippets, some are racing whippets, and then there's the lurchers, of course. The combinations. But if they're predominantly sighthounds, they'll be prone to corns. But you see, my two pet dogs, Malinois Greyhound crosses, have not got thin skin. They've got sort of Labrador pads, so I don't think there's any way that they're going to
Yeah.
get corns because they've got the cushioning there.
So
Yeah,
I take it you wouldn't see many in other working breeds like gun dogs, retrievers, pointers, etc.
no, it's it in the odd border collie maybe. I've seen it in border terriers. You can get them for the same reasons, um, and you treat them the same, but they're unusual, and it's difficult
Yeah.
to say why they've got them. Yeah,
Well,
you
I
have to
think that, that this technique ought to be, instead of just using initials, I think it ought to be changed to the Guilliard technique
well
for
done.
corns.
Yeah, that's it. Well done. Spread the word.
So a greyhound owner has a greyhound with corns and goes to the vet, and the vet has never done the surgery, is not familiar with it. Where would they go to gain familiarity with it? Just to the articles that are online?
Is a vet, yeah, or they can email me. Yes, I mean if you sort of put in corns in greyhounds, my name tends to pop up anyway.
Yes.
So there's an email address for me there, and I'll lock on that way. I think the biggest problem with corns is its diagnosis. I think a lot of vets miss them, and I see these dogs have been put down as arthritis. Oh, it's an ex-racer, therefore it must have arthritis, which is absolute rubbish because most ex-racers don't get arthritis. You tell me where it is, um, unless they've had some sort of severe injury to the wrist or to the hock or something like that. Um, so these vets have they tend to now sort of go straight to advanced imaging, CT or MRI, instead of treating the obvious. They don't possibly look for a corn, don't look for a corn thoroughly, and so, oh no, we'll put this through the CT, and then it's sent off a report. The report comes back and say there's a bit of a thickened tendon in the shoulder, or this, that, and the other. But it's nothing to do with the lameness. It's just coincidental. It's found. So you've got to eliminate corns first of all before you do anything else, and
Yeah.
spend an awful lot of money.
Yeah. It's you see that as a recurring phenomenon on the various greyhound discussion groups on
Mm,
Facebook. Somebody will
mm,
post and say, my greyhound's lame. We've been to the vet. They've taken
mm,
X-rays. They can't find any obvious explanation, and somebody in the comments will pop up and say, "Did you check for corns?"
Yeah,
And they
absolutely
do,
right.
and sure enough, that's what it is. It's
That's
amazing.
right.
That's the
Yeah,
first thing to look at. Just lift the paw up, and you can often visualize it, and if you
yeah,
can't visualize it, you can palpate it and feel it.
yeah. That's right. You need to squeeze it, and just you'll feel the thickening in it. If you squeeze it side to side and compare it with another pad, you'll realise there's thickening in there, and that's the fibrous tissue in the corn, the
Yeah.
keratin. Mm, yeah.
Here's a question: since you've treated both track greyhounds and coursing greyhounds, did you notice any difference in the frequency of occurrence of corns in the two types?
No,
Yeah.
no, not no. Um, no, I didn't know. Well, I didn't. I don't suppose I saw those many coursing dogs who were brought to me because of lameness. But no, I would think it'd be just the same. Don't think there'd be any difference at all. I mean, again, we'll go back to sort of foreign body pricks of the power. Depends where they're kept. And a great racing kennels near here, and he started to get corns in his dogs. And I went to his kennels, and he was walking them down to his gallop where the hedge had been cut, and it was something as simple as that
Yeah.
causing it. So,
And will you still treat the occasional active racer and return them to racing?
oh, absolutely. Oh,
Yeah.
yes, there's not a problem there at all, and they don't lose any time or anything. Doesn't bother them. No.
What's the any difference in the prescription, post surgical prescription for them for when they return to racing versus just being off lead in the garden?
No. Just the same, yeah.
Yeah.
Got them
Yeah.
back into training after just a few days. It's like the first case or second case I said, trainer had them back on the track after 5 weeks against my advice because I hadn't a clue what it would do, and it raced successfully.
Yeah.
Yeah,
Well,
yeah,
it's a great thing to, be able to give these dogs a pain-free walking life or racing life for that
yeah,
matter. And it's to your great credit that you developed this and had the courage in the first place to.
yeah, yeah.
That had to be a kind of a tense time when you were trying it the first few times without knowing. You're cutting a tendon, you're cutting natural anatomy, and
Yeah,
you don't know
yeah.
what the result's going to be. So it took a certain amount of professional courage to undertake that.
It was. It was selecting my cases with people I knew, I think. That was the thing. But then I got confident very quickly. But I had to sort of get signed consent for what I was doing, and I had to explain to people it was a novel treatment and things. But
Yeah,
people were quite happy to go along with it. Um, and now there's all sorts going on. Liverpool University, they've got a big project there. They're looking at the effect of cutting these tendons on the locomotion of the dog and the locomotion laboratory there and things. A PhD student is looking at that. I don't know if it'll produce anything good, but people have got very excited about it.
what
Yeah,
do they do? Slow motion video of the
yeah,
foot
yeah,
strike on the ground and that sort of thing.
yeah, force plate analysis and videos and everything. Yeah, yeah. Oh no,
Are
it's
they consulting you? Do they come back to you with
they
questions?
no, they consulted me because they wanted dogs for the trial. So I had to sort of contact a few people who I'd
Yeah,
treated recently, and I was absolutely amazed at the response I got. Nearly everybody, it's only half a dozen people or something, but they nearly all said, "Oh yeah, can we go? Can we help? It's been fantastic," and it just it lifted me to know that I was getting that sort of response. So they got the dogs.
yeah,
Yeah.
yeah. That's great. That's
Mm.
great. What you get any dogs over from other countries? Like anybody bring a greyhound over from Ireland
Well,
to have you do the
originally,
surgery?
yeah, originally I did have a dog from Ireland which had an old fracture of the P3 bone, the last bone, and we just did the surgery on it, and it was fine. That was a coursing dog. It went back to coursing.
Yeah,
Yeah, but no, I mean I get people from Europe, trying to find a vet in Germany or Holland or somewhere like that. And yeah, but they're out there. I'd say they can come over, but nobody has yet.
Yeah.
Yeah.
Well, that's
So,
great. Dr. Mike, it's a wonderful thing you've perfected. Certainly is a great benefit to the Greyhound breed and all the Sighthound breeds. And so, on behalf of Greyhound lovers everywhere, we thank you.
It's a pleasure, John. It's been very nice talking to you. Yeah, very good.
Well, we'll be on the lookout. We're going to post some links to the papers and so forth there on the internet, I take it.
Yeah.
And we'll get those out for those that like to do a little bit of a deeper dive into the surgical technique and the statistics of what the results have been, et cetera. So
yeah, that's fine. Yes.
Thank you for joining us, and keep up the good work.
Yeah, I'll do my best. Okay. Well, thank you. Yeah.
And Greyhound lovers, thank you for joining us for another episode, and we'll see you for the next episode.
Thanks so much for listening to the show. If you're not a regular listener, be sure to follow Greyhound Nation wherever you get your podcasts. We're also on social media, Facebook and Instagram. Just search for Grey Nation Show, follow us, and you'll get notifications every time we release a new episode. You can also get new show notifications when you subscribe to our YouTube channel. If you like the episode, leave us a review on our Facebook page or your favorite podcast app. You can also send us feedback or questions via the contact form on our website at greyhoundnation.dog. That's greyhoundnation.dog. This episode was produced in collaboration with host John Parker. Our theme music was composed and performed by Dimitri Taras. Thanks to Dr. Mike Guilliard for joining us for the episode. If your Greyhound or Sighthound has corns that are driving you and them nuts, visit some of the links in our show notes and share them with your veterinarian. Relief for both of you may just be a 15-minute surgery away. I'm Michael Burns, and you've been listening to Greyhound Nation.